Hi, my name is Yekta and I'm 16 years old. Today I'm talking to Professor Sharon Goldfeld about why it's important for every child to have the opportunity to live a healthy and fulfilled life. How is the work you're doing at Murdoch Children's Research Institute transforming child's health?
Well, here at the Murdoch Children's Research Institute, we're always trying to transform children's health, and we do it in different ways. So the way that I do it, together with my team and all the research groups I work with, is we're trying to create better systems and services and policies for children. We're doing research that helps services work out how they can be better, how they can make sure they're really delivering the very best to those children who most need it, or that they're reaching the children that most need it. And they're starting to work together, health, education, social care. And we're using digital technologies for trying to work out how to connect with families. So what we're trying to do is, rather than saying, hey, just this service, can you do well? We're trying to stack all those services together. So antenatal care, early childhood education and care, healthcare, all working together. So by the time that kid starts school, doing great pathway, great life.
What is the equity gap and how do we close it?
Well, let me give you an example of the equity gap. That's probably the best thing. So what I can tell you is, by the time children start school, there are 3 times the difference in their level of what we call developmental vulnerability. In other words, they're not kicking goals by the time they start school. And those 3 times the difference is between kids who live in the poorest areas of Australia compared to the wealthiest areas of Australia. So that tells us, hey, there's a lot of stuff we could be doing here to close that equity gap.
Have you always wanted to work with children?
I really have always wanted to work with children. So I started off when I was younger, working with children as a youth group leader, and then I became a doctor that only wanted to work with children. But I kind of realised that no matter how much I worked with each individual child, which was fantastic, I really wanted to make a difference to lots of children. And the only way to do that was research, and the only type of research is public health research. And the only place to do that is Murdoch Children's Research Institute, and really trying to work out how do we make a difference to children's lives here in Australia and internationally, and particularly around children's development.
That's amazing. Thank you so much.